Imagine a college student who wakes up one day and feels extremely tired, and they also notice that they have a sore throat and their tonsils, their lymph nodes are swollen. So when they touch here, they notice that it's swollen more than usual. And this could be COVID, it could be a cold, could be flu, could be strep throat. But as time goes on, they realize that they're more and more tired. So the doctor suspects that they have something called mononucleosis. Mono or infectious mononucleosis, or it's sometimes called the kissing disease, and I'll talk about that, is caused by a virus that's called the Epstein-Barr virus. It's human herpes 4 virus, and it's spread through saliva, which is why usually people link it to kissing, but you can get it through a lot of other ways. You can get it just by sharing utensils with someone, drinking from their cup, using the same toothbrush. So there's multiple ways you can get it, not just from kissing, it's through saliva. And once the virus enters your body, it goes specifically to a type of white blood cell we have called a B lymphocyte, and it starts infecting those cells. So the virus binds to this white blood cell called a B lymphocyte, and it gets in, and once in, it starts making copies of itself. So when the EBV virus infects these white blood cells, these lymphocytes, it takes control and it starts replicating itself. And during this time, your immune system is turning on, and so your body is really trying to destroy the infection and fight it. And so you have these infected B cells and your immune system super high trying to fight this infection, which is one reason people feel really tired. So when we see swollen lymph nodes usually indicate that someone is battling some type of infection. Your lymph nodes are essentially packed with immune cells. So when they swell, it means your body is fighting something. And so the symptoms you see with mononucleosis, sometimes you see fever because again, there's an infection. Sometimes you see a sore throat because the virus can be here causing inflammation, and then swollen lymph nodes because your immune system is turning on. So your lymph nodes swell when you're fighting an infection, which is a good thing because it means your body is making more white blood cells to fight an infection. So these are the typical symptoms of mononucleosis, and in some cases, sometimes people have it and don't have any symptoms, but usually you see exhaustion. So basically when you want to diagnose it, because the symptoms can mean a million things, you can take a blood sample from someone, and if you take a blood sample, you would try to look for something called Downy cells. So when you look at a regular blood sample, you see red blood cells and white blood cells, and one type of white blood cell is called a lymphocyte. In mononucleosis, lymphocytes look abnormal, and so we call that a Downy cell. So if you see Downy cells, they usually indicate that someone has mononucleosis, and these lymphocytes look different because they've been activated by the immune response. So these lymphocytes, these abnormal lymphocytes, the Downy cells, what happens is they become larger and their activity goes up and their nuclei becomes this weird shape. And so everything gets bigger, and so they just look weird. So you have nice round lymphocytes, and then Downy cells just look abnormal. So these Downy cells are key to diagnosing mono, because when you see them, it means that the immune system is fighting off the EBV virus. Could mean other things, but with these symptoms, most of the time Downy cells mean mononucleosis. For treatment, it's a virus, so you can't give antibiotics. And usually for viruses, we don't do anything. It's usually the way to get rid of EBV, like most other viruses, is rest and hydration and just taking care of yourself. And then if needed, sometimes people take pain relievers because of the sore throat, or sometimes they take ibuprofen to just lower the inflammation that's causing pain. And most people recover from mono in a few weeks, so it takes a while for your body to just attack it all. There can be complications from mononucleosis, so most cases are not complicated, but you have something in your body called your spleen, and in severe cases, the spleen can become very enlarged. And so this is why you're trying to avoid activity when you have this, so that your spleen doesn't rupture, especially because your spleen gets bigger generally when you have infection because of your immune system. And so with mononucleosis, again, it's caused by a virus. It's the EBV virus, which is also called the human herpes 4 virus. And it causes extreme fatigue. And the way we diagnose it, one quick way to diagnose it is to get a blood sample and look for Downy cells, which are abnormal lymphocytes, because these viruses infect lymphocytes. Another unique thing about mononucleosis is the virus stays in your body, usually we say for life. So what happens is it hides in your B lymphocytes in a dormant state. That means that it's just not active and it doesn't cause symptoms. And in most people, it never reactivates. But in rare cases, like if someone becomes immunocompromised over time, the virus can activate again. So that's mononucleosis.